First, I would deeply thank Dr. Azza Baraka for her great time with me, and also I would thank Jihad for her great introduction for my topic. I will discuss the news approved drug by the FDA as an anti-fusion inhibitor. It is called Salzentry or Maraviroc. For discussion of any drug, we all know that we must discuss its pharmacodynamics, the therapeutic uses, indications, side effects, and finally contraindications. What about pharmacokinetics? Salzentry is only available in oral doses. It is not given any injection or anything. It has 150 milligrams and 300 milligrams. It is digested in the GIT, absorbed, and then metabolized in the liver to be metabolized by the cytochrome D450 enzymes. Then it is excreted finally in the urine. Pharmacological action, as Jihad has explained, the HIV virus enters the cell through the CD4 receptors and other co-receptors. Here it is a CCR5. So the virus attaches in normal cell the virus attaches CD4, the CCR5. When giving my drug, it will inhibit the CCR5 site. So the virus will not be able to attach to the co-receptor and finally will not be able to enter the cell. The therapeutic uses, the only use for Salzentry is an anti-CCR5 antagonist for HIV patients. For the indication, we talk about three categories: the adult patients, the pregnant women, and then the pediatrics. For the adult patients, it can be used for both naive and experienced adults. Yani those who have been taking medicines for a long time and those who have recently started taking medicine. As for the other patients, it can be used for two purposes. First, as a co-helper with other antiretroviral regimens to prevent the entry into immune cells. The second, when the other antiretroviral regimens fail to behind the viral infection in my body. As for the pediatric, the safety and the efficacy of Salzentry haven't been ensured yet, so it is not given with pediatrics. As for the pregnant women, after weighing benefits to risk for the pregnant women, I should decide. If the risks are more, I shouldn't give it to her. If the benefits are more, I will give to her for her to prevent the transmission of the virus from the mother to the fetus. Then, we must give Salzentry in combination with other antiretroviral regimens. Why is that? Because in the patient's body there are infected cells and other non-infected cells. My drug targets the non-infected cells to protect them from infection. While I should use other antiretroviral regimens to help the other infected cells for not budding of the viruses from the cells, to prevent replication of the viruses into the cell, and so on. So it must be given with other antiretroviral regimens. Okay? What should I do before giving Salzentry? As Dr. Azza has explained, I should first give a tropism test for my patient. What is this? We said that the drug is CCR5 antagonist, so it only triggers the CCR5 co-receptor. So if the co-receptor, if the virus doesn't use this co-receptor, it will not be effective against this. So it will develop serological resistance, and I don't want this. So I must give it, and the test must be highly sensitive, because if the test was negative, and then I discovered later that the patient has another type of the virus, it will also develop virological resistance. So I must be very sure with this test. Drug interaction, we said that it is metabolized in the liver, so any drug which induces the cytochromes will also decrease the level of the drug in my body. Any drug which I use that inhibit the cytochromes will increase the level of the drug in my body. Adverse effects. After the virus, the cells become infected, so my immunity decreased. So after giving the drug, I stopped the virus from entering the cells. So my immune system became active again. So it starts to target any pathogens that are hidden in my body, such as TB, such as herpes virus, herpes simplex, any other virus that was hidden. And all of us had hidden viruses. So it starts to target these hidden pathogens and cause immune reconstruction syndrome affecting my cells. Also, it develops other common signs like cough, fever, cold rash, muscle pain, joint pain, and stomach pain due to these allergic reactions of the immune system again. As a result of immunity competence, it may develop hepatotoxicity, so this drug is not used with hepatic patients, may develop cardiovascular effects, hypotension, and in few cases, infection or cancer have been reported. Contraindication, as we said, it is contraindicated in hepatic patients. Also, we said that it may cause cardiovascular effects, so it is contraindicated to give in cardiac patients, hypertensive patients, and since it is excreted in the urine, so any renal impairment will cause a problem with this drug. Finally, I can make a small comparison between Fusion and my drug. Can I give them in both in a comparison, in a combination? Yes, I can. It is safe to use them in both in the same combination, certainly with the other antiretroviral regimens. But in the idea is in Fusion, it can be used not least age 6, while in Presentry, it can be used above 16. There is difference in age. So the doctor must be sure about this. Okay? This is my references. Thank you.
جماعة بيسي معانا صديق يا إما ونص